Abnormal uterine bleeding is one of the most common reasons that women go to the doctor. It can occur at any age and it has lots of causes. Some are pretty easily treated while others are more serious. Dr. Frank Cirasano of Boca Raton Regional Hospital joins us this noon to tell us a little bit more. Good afternoon.
Thank you, Lauren.
Glad to have you with us this afternoon. Let's start with the basics. What is uterine bleeding and who's most susceptible?
Sure. Uterine bleeding is, or abnormal uterine bleeding is bleeding beyond the normal 5 to 7 days of a normal menstrual cycle, and it can be associated with debilitating pain and caused generally by the development of tumors in the uterine wall or in the uterine lining.
Okay, and what are the symptoms? Is there any sort of pain involved, or how might you know, other than the bleeding? I mean, how might you know you have it?
Generally, the pain is severe and debilitating and often requires missed days from work. That's a general telltale sign.
All right, and what usually typically causes this, would you say?
Tumors that develop in the organ of the uterus can be benign, such as polyps in the uterine cavity or fibroids in the uterine wall. Additionally, in a small percentage of patients, these type of tumors may be malignancies.
Okay, so a woman goes to the doctor, she explains the situation. What is sort of the typical treatment protocol?
Most important early diagnosis measure is to evaluate whether or not there's a malignancy present, often with imaging or a biopsy. In the absence of a malignancy, the lining of the uterus can now be treated with thermal energy using this device here, which is a thermochoice balloon.
Okay. Let's try to get a close-up of that if we could. Okay. And is this the balloon here right on the end?
That's introduced to the cavity of the uterus. And
hold that up for you.
The application of heat to the lining of the uterus actually has been demonstrated to reduce the amount of bleeding and the amount of pain with cycles.
Okay. And so would this be considered an alternative to surgery or part of the surgery?
It is an alternative to surgery and probably the most effective non-surgical alternative.
Okay. Talk to me about recovery.
Recovery is usually within 72 hours. Most patients can be treated with this procedure in the office. The total procedure time is about 8 minutes.
No kidding.
The symptoms of discomfort and cramping usually resolve after 72 hours, and oftentimes patients can return to work the same week.
No kidding, and that's much better than it used to be.
Well, the surgical option obviously comes with the recovery of an incision, or, more recently we now have the robotic laparoscopy option, which is probably the most remarkable surgical advancement.
Okay, amazing. It's amazing what technology can do to speed up all of this for so many women. Thank you so much for your time today. And Boca Raton Regional Hospital does sponsor our expert and underwrites our Ask the Doctor feature.